Welcome back, everybody. JC here with FMR Therapy, and we are going to calf mash today. Get your shoes off, get yourself some type of ball, and start at the bottom of your feet, right? So if I'm going to work on the calf, I don't want to forget about the bottom of my feet. We're just going to go right into that arch across, right underneath the toes there, that metatarsal arch. We're going to go down into the other arch of the foot right in there, right? And we're just putting pressure, and then we're not putting pressure, not putting pressure. Just back and forth, back and forth. Rolling is great, but be sure to stop and just put some pressure in there. Do that foot for about 1.5 to 2 minutes, and then switch over to the other foot and get the other foot for about 1.5 to 2 minutes. Just go all up into the heel, go all around that foot. If you find something that really kind of feels uncomfortable, don't shy away from it. Press on it a little bit, then come off of it, press on it a little bit, come off of it, and really work on wiggling those toes around and whatnot. But that's not what it's about today. Today it's about the calf. We're going to start with a foam roller. Stick around because I'm going to show you how to do this with no equipment whatsoever. But if you have a foam roller or something like it, then we're going to get on the floor. We're going to put that foam roller right, we're going to start up just above the heel, right on the Achilles. And we're going to move our leg back and forth like this. I'm literally rotating my whole leg. If that's not enough pressure, I can put my other leg on top and I can roll back and forth. And if I still am like, that doesn't do much, I'm going to elevate my keister with my hands, roll back and forth, back and forth. Do that for 20, 30 seconds. Then I want you to switch over into changing your ankle shape, right? So in the biz, we call this dorsiflexion and plantar flexion. Dorsiflexion, plantar flexion. All you need to call it is toes to your face, toes away from your face, right? Doesn't matter. But we're going to spend at least 20 to 30 seconds doing that as well, right? Then we're going to roll up a little bit. So now I've moved my foam roller up. I'm going to go back into 20 to 30 seconds of just cross fiber frictioning that. Just letting that foam roller dive into the muscles of the backside of my leg. And then I'm going to switch back over into this flexion back and forth, back and forth. The slower I go with this, the more you might see a little bounce in how your ankle can control your foot and whatnot. Good stuff. So we're going to go all the way up the back of the leg. You don't need to go into the crease of the knee, so stop just shy of the crease of the knee, and then get the other leg. If you don't have a foam roller, but you have a little double ball, little peanut or infinity ball, same thing. We're going to start right there. We're going to wiggle that leg back and forth over pressure with the other leg, and then of course the ankle, toes up, toes down, toes up, toes down, right? Dorsiflexion, plantar flexion. Working our way again up the back of the leg. You can do this with one ball. It's a little trickier. You're not going to be able to do as much of the back and forth. It gets a little balancy, but definitely can get that ankle back and forth, back and forth. This is also a situation where you can crawl up the inside of the calf just with that ball and just be mashing up the calf. That's another video for a different day. Big old ball. This is a great one for this particular exercise, especially if you get elevated a little bit. Spiky ball, same thing. Let's say you just have like a broom around. This is a little piece of a barbell. Same thing here. You can really get into the tissues of the back of the calf simply by going back and forth, and just working your way up. But let's say, in 2 minutes per leg, right? 2 minutes minimum, 2 to 5 minutes even better. Let's say you don't have anything. Well, we are going to go Philip Beach status here. We are going to use the shin bone for our tool to work out the back of the calf, right? Learned this one from the works of Philip Beach. Great guy. So I'm going to get into a position where I can put my leg on top of my other leg. I want to start down here on the Achilles, and I'm literally taking this bone of my leg and I'm going to put it right on top of that Achilles, and I'm simply just going to lower my body onto that, right? And just breathe into that. Really just let it happen. Take nice deep breaths. Don't hold your breath. Then I can take said leg. I'll turn a little bit so you can see what I'm doing here. Take said leg, and I'm going to saw my Achilles with that leg. I'm literally grabbing on to that tissue and sawing it back and forth. Then I'm going to work my way up toward the calf, Same thing, I'm just going to sit down and let the weight of my body push my shin bone into my calf. And then I'm going to come up and just kind of wiggle back and forth and saw, right? And I'm going to work my way all the way up as far as I can go. This gets a little bit tricky if you have, plantar flexion problems in the ankle, if this stretch is difficult to do for you, or if you do not have full range of motion of flexion of your knee. So if this is painful on the knees or painful at the ankle to be in that position, then using a tool is going to be better for you. But if you don't have a tool, you're out on a run, out on the trail, you got nothing, and you need to warm up, and we've talked and I've told you that stretching your calves is probably not going to help you that much, then use your shin bone, get into your calf meat. Don't forget to also kind of use your calf a little bit, right? So little stretches like this where you're pushing into that dorsiflexion with a big, extension of your big toe back there. Great stretch to do, great stretch to do. Down dog, good stretch to do in terms of you're preparing for something or you're finishing something, but really getting into that meat and then being active with that, right? So by that I just mean, kind of using your calf, your new range of motion of your ankle just a few times before you go off on your run, before you have a long day at work. Those kinds of things can be super beneficial. We're really targeting people that have knee pain, foot pain, ankle pain, or issues or something like that going on. Even if you have low back pain, this can be a really, really good strategy to use daily to get that back side of the posterior chain loosened up. Give it a try, you guys. Thanks for sticking around. I'll see you next time.